Marked Dr. John Bartholomew Bastyr's 100th birthday, and the clinics that bear his name in Seattle have become synonymous with the world of natural medicine.
Doctors Peter Bongiorno and Pina LoGiudice are Bastyr University alums, and they joined us now to talk about how natural medicine has become a part of the mainstream medical community. A very interesting topic. We appreciate you guys being here.
Of course. Thank you so much for having us.
Obviously, Bastyr has been on the forefront of trying to get natural medicine into the mainstream, and that's definitely the case now. Why has there been such a shift, and why has natural medicine, which was once kind of, looked at from an outsider view, from the, the mainstream perspective, how come that's so much more accepted these days?
Well, I think natural medicine is something that at one level or another people have been doing for years and years. I know my parents, my grandparents who are immigrants from another country, they were always using it. I think with the modern invention of the antibiotic, which saved a lot of lives, modern medicine started to be more drug-centered. But what we're learning is that what worked for a simple infection isn't working as a model for many chronic diseases, and people are realizing that now something else needs to be brought back. In 2005, the New England Journal of Medicine had an article that said that life expectancy is actually decreasing again for the next generation, which is the first time it's ever happened. So there's a need for it.
So what facets do the two of you focus on when it comes to natural medicine? What are we talking about here?
Well, when we work with our patients, we always are trying to find the underlying cause of their condition. So when we sit with a patient, it's a very comprehensive health history intake, and we look at all aspects of their life, things that may be contributing to their health, whether it's their diet, their stress, their sleep habits, or exercise habits. And then we'll look at it and from a perspective of, okay, what's happening with this person in combination, and then we'll try to support their body using whether dietary modifications or, again, these lifestyle modifications or herbal medicine or nutrients or botanicals, any of those areas to help build the body up so that they can optimize their health.
One thing that I noticed when I was going through cancer treatment, I was asking my doctors, what should I be eating? Should I be changing my diet significantly? And they just said, just eat well, because there was no real documentation that they had bought into to indicate that diet could make a huge difference. But there's a lot of research out there showing the exact opposite. Where do you stand on diet in terms of kind of preventative medicine?
Absolutely. There's an article that came out in December, this past December, in the British Journal of Medicine, and what it talked about is how almost 50% of all cancers could be prevented with diet and lifestyle changes. So not smoking, eating organic, eating very cleanly. So this is very powerful medicine. Imagine if there was a medication that could do the same.
Something else that a lot of people talk about with regards to natural medicine is mental health. That can be it's a touchy topic for a lot of people to get into, especially when it comes to taking drugs versus not taking drugs. Where does natural medicine come into play when it comes to mental health?
I think very strongly. Mental health, for example, I do a lot of work with depression, and depression is just a catch-all phrase. It doesn't tell you what the issue is. And that's usually because the issue isn't just about neurotransmitters and the molecules in your brain that make you feel good. It's also about how your digestion's working, because most of those molecules are made in your digestive tract. So if you're not eating well, and they've done a lot of studies in Spain showing the Mediterranean diet alone will prevent upwards of 60% of anxiety and depression cases if everyone just ate cleanly that way.
Okay, so if there's one thing that we should be eliminating from our diet, what is it, and what one thing should we be adding to our diet?
One thing, I think in terms of processed foods, I think are a big problem because our body just doesn't know what to do with it because of the chemicals that come in it, whether it's hydrogenated oils or high fructose corn syrup. Any of those things our bodies don't know what to do with. So I would say anything processed, I would definitely have people immediately eliminate. And just add some fruit and vegetables, and even just some strong antioxidant fruits like any berry is really wonderful and could do miraculous things. Most of us are actually dehydrated, so just simply drinking our water as well. So going back to the basics will be profound.
Dr. Peter, Dr. Pina, good to have you this morning.
Thank you so much.
Thanks so much for your time.